Ladies and gentlemen, hi there, hello there. So these next few seconds serve two purposes. The first one is a sound check. How we doing? Little much? Little much? All right, Danny's gonna help me out there. That feels better. Thank you so much. Welcome. This is not the beginning of our program. This is a clear signal for you to get some food. So if you haven't found a seat yet, please mark your way, grab a beverage, and head through the buffet line. Enjoy. All right, ladies and gentlemen, we are going to start this program in about 8 minutes. So grab some food, find a seat, get settled, and ready to go.
We help entrepreneurs, investors, communities grow companies of significance. We get behind entrepreneurs, builders, innovators, and we connect a community of mentors and resources, capital for startups, customers to support growth, to those with the courage to grow the next great business in Kansas and beyond. Ready to support, invest, and grow? Be a part of the next us.
Hello there. Good still morning for a few more minutes. Ladies and gentlemen, my name is Mary Beth Jarvis, and on behalf of NXTS and this program, the NXTSTAGE Community Health and Vibrancy Pilot Competition presented by Blue Cross and Blue Shield of Kansas, I want to be the first, but not the last, to welcome you here. Delighted to see so many folks in the room. I want to just say that this is a lunchtime event. You all are coming from places and you're going to places, so we're going to keep it moving. It's going to be invigorating, exciting, but that also means that you'll have people halfway through lunch like, excuse me, pardon me, excuse me, and grabbing their food and coming to sit down. That's totally fine. When we've got our startups up here with the spotlight, that'll be the reason you came. So we'll get through a little bit of the background, talk a little bit about the folks that made this happen. Then we'll get to the meat of today, and at the end of this luncheon, we will hope to leave you some time to connect with these exciting individuals that are here. But first, and as we officially kick off this 5th Community Health and Vibrancy Innovation Showcase, I want to invite a very special guest to the front of the room, our mayor, Madam Lily Wu.
Thank you very much, Mary Beth, and thank you to your entire team at NXTS. Can we give them a round of applause first and foremost? This is truly a privilege to come back here to this very space. Just last week, we were hosting bloggers from around the world and nation right here in the Air Capital because they chose Wichita as a place to showcase for their TBIX America Summit. So I'm really glad to be back here. I also had the opportunity to meet many of the innovators this week on Tuesday as they pitched for a very smaller or shorter amount of time. And I'm so grateful to see these innovators that are really trying to promote health and wellness here in our communities. Several of these pitches were about reducing anxiety, also reducing workplace violence, also others that were trying to increase community health workers in their cities, and also increasing social media literacy. Hello, Jane. And also an AI tool to help you write grants. So you're going to be in for a great treat as you hear these pitches. But really, this is about the NXTSTAGE Innovation Showcase that is an opportunity to meet these innovators and not just hear their pitches, but really connect to see how there are opportunities, mutually beneficial opportunities for all here. So as the 3rd mayor for the city of Wichita, I truly am grateful to help welcome you all to this summit and this showcase. I always say that I start off my day with gratitude and focus my energy around that. And I'm so grateful every morning to wake up here in America, be an American, lucky to live here in the city of Wichita, and honored to serve as the mayor for this city that I have called home since 1993. Here in Wichita, the Air Capital, I like to say that AIR stands for Aviation, Innovation, and Research. These are the forces that keep our city moving forward. But Wichita is also known for something else, its entrepreneurial spirit. That drives the creation, the attitude for building, and the attitude to solve problems in our communities and for generations. And it's exactly what brings us all here today. Now, this innovation showcase is about pairing the same entrepreneurial spirit with bold new ideas to improve health and strengthen communities across Kansas. To our visiting startups, you have my admiration. Wichita already knows the value of your work, and we're proud to be working with each one of you. including Polko, who helps us with our annual community-wide survey. I hope your time here leads to many more opportunities to serve Kansans and to grow your businesses. To the health, education, and economic development leaders from across the state, I salute you. By looking to entrepreneurs, the problem-solving superheroes, you're helping your communities lead ahead. And to my fellow Wichitans, thank you for your commitment to innovation, like Superintendent Kelly Bielefeld. As you listen today, I encourage you to ask, what community change could we create with this approach? Who else should be hearing about these new innovations? So again, thank you to all of you for gathering here. We have the opportunity to tackle big challenges, but also unlock new solutions and build a healthier, more vibrant Kansas. Welcome to the Air Capital and enjoy the showcase.
She's pretty good at that, huh? Ladies and gentlemen, what I didn't tell you at the beginning of this is that in addition to you here in the room, we've got cameras in the back that are capturing and live streaming this around the state. And this turns into a program that lives on throughout the year. So if you're sitting here throughout this hour going, gosh, I wish so-and-so was here to hear this, was here to make these connections, was here to get inspired by this activity and what it could mean for communities and organizations both here in Wichita and around the state of Kansas. There'll soon be a YouTube link that we'll send out to everybody that you can share to take today and make sure it lives on. But for the rest of the hour, I'll go ahead and keep talking to you here in the room. And we have a special treat for you because the presenting sponsor for this event, the team that helped us conceive of this unique one-in-the-nation program, is here to also welcome you. Ladies and gentlemen, Virginia Barnes from the Blue Health Initiatives with Blue Cross Blue Shield of Kansas.
Officially say good afternoon. It's great to be here today. Thank you, Mary Beth and Colette and the entire Nexus team. They always do an amazing job putting this event on. And Blue Cross and Blue Shield of Kansas has been really pleased to be a part of this event for the last 5 years. As the largest and only local health insurer in the state, we are very proud of how we invest in our communities. And whether that be here in Wichita or out in Colby or Hodgman, it is important to us as a nonprofit insurer to know that we are helping our members all across our state have access to innovation, new ideas, quality of life, and the best health possible. And I will say I just get particularly excited about this event every year, partially because I don't have an entrepreneurial bone in my body. Like, these founders amaze me every time because, you know, you'll hear their stories and you hear them say, you know, I had this experience and it wasn't good and I'm gonna go make a solution and fix this. Or I saw this big challenge happening and it wasn't right and I will go take on that challenge. You guys are incredible. And at the same time, one of the best part of my job is that I get to work with those same people in communities across Kansas, the ones that have, you know, perpetually wearing 20 hats. Maybe not all as good as the Greens hats here in the front of the room. I'm particularly like that hat. But, you know, the people who are saying, this is my community, every day I will make it better. And this event brings those two teams together, those two people. And so every time I come, it's magical, and I just hope you have as much fun as I do today. So thank you for being here, and I can't wait to see the pitches today.
Thank you, Virginia, and thank you, Blue Cross and Blue Shield of Kansas. There's not a part of this that they don't make better. In addition to their support of the program, they also provide some seed grants. So later on today, when we're announcing these pilot partnerships that are going to in turn into implementations in communities around the state, know that they were at the heart of even those implementation efforts. All the way from conception to implementation, we really want to make sure this program does the most good around the state that it can. Now, it takes a village to make this program happen. In addition to Blue Cross and Blue Shield, we have other sponsors that are a big part of what we do. We're thankful to all of them. Many of them are represented here in the room. So let's do a little bit of we've got Blue Cross around here in the front. We have the Kansas College of Osteopathic Medicine representatives. We got an amazing tour of their facility and institution the other day and got to feel the innovation that sort of hums through the air over there. The KU School of Medicine Medical Practice Association, these guys are where academic and clinicians meet, right, to serve our community. Thank you so much, Aaron Ryan and the KU School of Medicine MPA team. The Greater Wichita Partnership is a supporter of all that Nexus does, including this program, and they hosted us on Tuesday at their facility. We're so grateful for their 501c3 arm, Opportunity Wichita, supporting this program. Tell them thank you. We're also super grateful to Hinkle Law, the Siemens Company, the Kent Audiovisual for their great work at Friends Prices today. Those supporters help make today's awesome event happen. Thank you very much. There's also some individuals in the room. Virginia mentioned our Nexus staff, Mayor Wu mentioned our Nexus staff. You guys raise your hand so they know who to come find if they've got questions or just want to say thank you for the great work that you do. We are a small but mighty nonprofit. Connor and Ellie and Colette are here. Amber happens to be up in Detroit representing us along with the city-to-city visit that the Chamber of Commerce assembled this week. So she's up figuring out what great, innovative, entrepreneur-fueling programs we should be doing down here, mocking those, or mimicking those that are happening up in Michigan. We also have some members of our board of directors here today. I saw Trish Braystead, I saw Evan Roselle, the volunteers that help us drive this train in all the right direction. Please raise your hand. Thank you, thank you. They're like raising it to cheek level. They're so shy. We also have a group of folks that we use and employ around the community to help spread the word, not only of what Nexus does, but what other great entrepreneurship support organizations and innovation organizations do in the community. We've got representatives from Wichita State, from the CREATE campaign, from all sorts of folks that are collaborating in the community to drive uplift for our innovators and for our entrepreneurs. We call those our program advisors, and I know there's 4 or 5 of those folks in the room. Raise your hand. Thank you so much. Appreciate your contributions. And then you may have noticed that there was a sponsor on that slide that I didn't mention, and that's because they're going to get a special spotlight here, not only for their contribution to this program, which helps ensure that the rural organizations that come in this week do so not on their own dime, and that we can host them here without it costing more than just the blood and the sweat of being involved in this program, but that we can cover their travel and accommodations while they're here in Wichita engaging with these innovators. For that grant that helped, or that sponsorship that helps us do that, we are super grateful to the Kansas Health Foundation. And at this time, I'd love to welcome Alejo to the front. Thank you, sir.
Thank you, Mary Beth. Thank you, everybody. It is an honor for the Kansas Health Foundation to be here today and to be one of the sponsors of this event. At the Kansas Health Foundation, we believe that our nation, or that Kansas should lead the nation in health. Kansas used to be in the top 10 in health several years ago, and unfortunately, we've dropped to the high 20s. Where's my coin? If you see Kansas staff around, you might see us carrying a little coin with the number 28. That's where we currently sit at. That's not good enough, right? And so from our end, we believe that there's a natural connection between entrepreneurship, the health of our economy, and the health of our state and Kansans. And in fact, this is true. The number one predictor in someone's health is actually their socioeconomic status. And so through this event, we see opportunities to not only improve the health and vibrancy of our communities, but also to improve the entrepreneurship and the business success across the state of Kansas. You know, everybody, you'll notice a book, Leading Health. We encourage you to read it and to learn more a little bit about what we call capital H health and capital H and lowercase h health. Our belief is that together, it's going to take every Kansan to help us go from 28 to number 1. Right? And we believe that we can be number 1. And so it isn't just going to be us, though. It's through experiences and programs like Nexus and partners across the state and the city and cities and local governments but also entrepreneurs and small businesses. And so we encourage you all to read your book. We encourage you to visit our website, kansashealth.org, learn more about the work that we're doing and how each and every one of us is going to help Kansas lead the nation in health. And thank you, Mary Beth.
Hi, my name is Laura Robbins. I'm the co-founder and chief operating officer of Advocacia. At Advocacia, we remove barriers to public benefit programs such as Medicaid, SNAP, and thousands of other programs across the country. We participate in the Nexus program because the program aligns so closely with the mission of our organization. To live healthier lives and have vibrant communities is something that we hope to have a positive impact on across the country every day in the work that we're doing. And that alignment allowed us to apply and fortunately become a finalist and work with the great community members throughout Kansas.
Hi, my name is Travis Rickford. I'm the Executive Director for Live Well, Northwest Kansas. For the last 3 years, we've been involved in the Health and Vibrancy Contest and just been really impressed with our ability to connect with startups from all around the United States. And in particular, we've had the chance to partner with Advocacia through our insurance navigation program. And as a result, we've been able to enroll hundreds of Kansans in Northwest Kansas with insurance. So we're excited to continue this partnership and bring more resources to our region.
I'm Valerie Olrogi. I'm an insurance navigator with Live Well. Using Advocacia, the screening tool has taken a huge weight off my shoulders as a navigator. Instead of juggling multiple platforms or re-entering the same information, I can screen consumers and immediately see what programs they might be eligible for. That includes like Medicaid, your charity care at the local hospital, food assistance programs, or marketplace coverage. It saves me time, it cuts down on paperwork, and more importantly, it helps me to better support those people. I feel like it reduces the ability for people to fall into those cracks, which means I can serve more families and have confidence that they're getting the help that they deserve.
It's such a unique opportunity. I'm so happy that we were able to participate and that we continue to work closely and making sure that we're able to have that positive impact. It's just been a great working relationship since 2021, and we really appreciate the collaboration and partnership that we've continued to see, and we appreciate all of the relationships and the opportunity to collaborate.
Okay, so what was that little video, you asked? Well, hey, pretty exciting development in the program this year is that we were able to secure, alongside our partners at Thrive Allen, a Networks for Change community grant that allows us to do some storytelling around this program and the impact that it's had around Kansas. We're so grateful to Blue Cross Blue Shield of Kansas, Network Kansas, and the Kansas Health Foundation for getting behind those community grants that get distributed statewide for individual projects that without those grants wouldn't have happened. And in this case, what will be able to happen is beginning today, where you'll see a couple of these snippets throughout your time here, we'll be able to get the word out to other community partners, other corners of the state, the 105 Kansas counties that all could benefit from getting a front row seat and get exposed to these innovators. You will notice today that innovators who are our finalists today come from all over, coast to coast. Just this year, there were 143 applicants coming from 27 states and 15 countries. These are all innovators from around the world who believe that what they have to offer Kansas will be promising and relevant to help our communities advance, help break down their barriers to community growth and vibrancy, help improve their population health outcomes. And over the last few years, you can see what this program has accomplished. More than 500 startups have competed, so many countries and states represented. We've had 43 finalists, add 10 today, and up till this year, 55 innovation projects announced throughout the state that have done good things, like the work you saw with Advocacia. Yep. But just you wait, you'll be running out of fingers later on when we talk about what projects are going to come out of this year's competition. And that's the energy we'll continue to build to throughout this program. So I'm going to jump off the stage for a bit. We're going to show you one more of our storytelling exhibits, and then we'll get to the meat of today, where my colleague Colette Atkinson will come take us through the pitch. Here we are at the ballpark. going to get to see a pitch showcase, which we find awfully fun. But I want to say this because I want these 3 ideas sort of running through your head over the next 10 times 2.5, 3 minutes. There are 3 reasons that we began this competition alongside Blue Cross Blue Shield and our other partners. 1, we believe that Kansas communities should not be last in line, but in fact should be first in line to get access to innovations that have the power to change their communities. Here in Kansas, we have urban, we have suburban, we have rural. It's all within a stone's throw, and there are future-minded community organizations and leaders around the state, but there wasn't a way to connect them to folks that could be a solution to some of their most long-fought struggles. How do we work smarter, not harder? We serve these community institutions and these leaders around the state with access to innovation and new ideas and new solutions. So that's purpose number 1, getting us off of the, out of the hallway and into the front row for access to these innovators. Second reason is core to Nexus's mission. We help entrepreneurs grow companies of significance. We want innovators to be able to thrive here, to build their businesses here, whether they were birthed here in Kansas, we love those, or elsewhere. So we will import great innovators if that means that we can be a part of a mission to help these companies gain purchase here. We believe that the air capital could turn into the pilot capital. Why shouldn't we be the proving ground for new innovations, just like we are for restaurant concepts and hotels? Why isn't this the exact place to prove out a game-changing community health solution? Kansas can, in fact, be that proving ground. And then the last purpose that we set it up is that we want to improve the health of Kansans. I tell Virginia all the time, I'm jealous. She gets to wake up every morning with her role in life being to make Kansans healthier. What satisfying work that is. And we want this program to continue to be a big part of that now and for years to come. So I will leave you with one more storytelling video. Colette will come up and take you through some pitches, and I'll come back a little later in the program to tell you where we landed and see how far up we can take that 55 projects to date number. Let's have at it.
As Scott County's Economic Development Director, we had evolved into a highly effective organization for Scott County, Kansas, and created a bright spot for rural. We received $5,000 in grant money from Kansas Blue Cross Blue Shield. And we utilize that to invoke a partnership with Televeda.
My name is Shruti Gurudanti. I'm one of the co-founders of Televeda. What does Televeda do? We help address social isolation and loneliness. That is our core mission. And we focus specifically on rural communities, seniors, and veteran communities, along with indigenous communities as well. And when we partnered with the pilot partners such as Thrive Allen County, Hodgman, Scott City, we worked with the communities to help deploy the Televeda platform, which helped connect residents in these areas with various peer groups based on their hobbies and interests. So we had groups like yoga, Tai Chi, digital literacy, bingo. Bingo was huge, but really essentially the goal was to help bring members in the rural communities together to help create this feeling of finding a sense of belonging and finding a sense of community through technology, and using technology as a means to building that social connectivity.
Out in rural Kansas, you kind of know your folks. You know what's going to go and what won't. But if I stayed in that safe space, we were not going to come up or be associated with anything that was innovative. And so I participated knowing it would be good for my community, but also I'd have personal growth.
We have had a fantastic experience working with the Nexus team, working with our pilot partners, and also actually getting to know other startups in the area and in the country, and all of the cool things that they're doing for communities around the world was huge. So would highly recommend startups as well as pilot partners to give Nexus Innovation Challenge and showcase an opportunity and really try it out.
right, good afternoon, everybody. How are you guys doing? Yes, give yourself a round of applause. This is beautiful to see. Okay. My name is Colette Atkinson, and I am the program manager for Nexus. I manage the Community Health and Vibrancy program, as well as our FinTech program. So, I get the honor today to introduce you to our top 10 finalists. Before I do that, I want you guys to look around the room. If you can, look around. We identified you guys all as connectors in our community. So we are asking you to take out your phones. We don't need the silent. We need your phones out. Like, take notes on these as they do give you their pitches. And we want you guys to intentionally connect them with people in the community because their innovations can help speed up things here in Wichita and Kansas. Okay, so we went from scouting since I started. We went from scouting to finalizing the finalists, to working with the partners to select those finalists. And I'm so excited today to introduce you to some people that have community health solutions, community growth solutions, and then the vibrancy piece. And we have to give it a little corny bit of the baseball theme. We're gonna give them not 1, 2, but 3-minute pitches to give you guys a chance to hear about their programs. And we'll first start off with, I would say, a pharmacy solution here in the city. I will call up Amber Beck with Caron Health.
Hi, everybody. My name is Amber Beck, and I'm the Executive Director for Caron Health. And today, I would like to take you on a short health journey. What would your life be like without your meds? How would you feel? Would you be able to function? Would you be able to work? 1 in 5 adults can't afford their meds due to cost. So let's talk about that cost. You know, you think about my average pill, about 30-day supply, is about $18. Manageable, right? But what happens if I'm on 3 or 4 or 5 different medications? Now we're talking about $80 to $100 a month. And if I'm on insulin, one 30-day supply is about $250 a month. We have Kansans right now asking themselves, how am I gonna afford my meds? That is why we started Caron Health's charitable pharmacy. Since we opened in February, we have received over $1 million worth of donated medications that we've been able to put right back into our state. $1 million, right? Wow. We're in 23 counties currently, and we're continuing to grow every day. We carry over 195 different medications in our pharmacy, and you can always find that up on our list on our website. We ship USPS because we want individuals to have access to that no matter the barrier of transportation. And because we ship USPS, that means we can ship it directly to the client's door even if they have a PO box. The cost for clients is $10 for oral meds each time I dispense and $20 for insulin. The medications are free. We want them to have access. So, for every story I told you is a face. Think of that child who now can breathe easier because they have their inhaler. Think of that parent who can now say, I have my insulin and still have money for rent. Amazing. Think of that grandmother who now has access to her heart medication because it's affordable. But we cannot do this alone. We need you to introduce us to individuals in your communities that need our assistance. We need you to connect us with those doctors and hospitals. We do not want this to be the best kept secret in Kansas. We can make Kansas healthy one patient at a time. Thank you very much.
Great job, Amber. We're going to break this up into 3 parts. Okay, like I said, this is the Community Health Solutions part. Our next finalist is Eric with Grown By, and then they'll be followed up by Isis with Green Health, and then finish up this section with Julia with Pear Suite.
Hey everyone. My name is Eric. I farm in Malacca. Winnetka, Minnesota. And with my day job, I'm Director of Accounts and Partnerships with Grown By. Grown By is an online e-commerce platform. We are cooperatively owned and operated by farmers and for farmers. We connect farmers to direct market channels such as retail, wholesale, CSA, which is like a subscription food box, and soon point of sale. Our farmers grow some of the most nutritious, healthy, delicious food that you can possibly get. There's about 1,000 farmers who use Grown By. We were founded in 2019, but to the point of access, we all know in the room the food at the farmers market is more expensive than the food you can find at some grocery stores or other options. It's higher quality food, but not everyone can afford it. And so to address that problem, we were very proud to be the first place in America that SNAP beneficiaries could spend their SNAP dollars online directly with local farms. This is an enormous, thank you. It is an enormous thing for food access. This is not me in my pitch. This is an enormous thing for food access, but there is not money to promote it. So a lot of people in this room probably didn't even know that people could spend their SNAP dollars online with local farms. Speaking of money, I do farm, as I mentioned. I know how hard we work, and I know how little we earn financially, but you don't always know that. At the grocery store, farmers get about 17 cents of your dollar. So the other part about being a farmer-owned cooperative is we are our own owners. We serve ourselves. We get ourselves 95 cents on that dollar when you shop on Grown By. So I mentioned we have farms across the country, in every state of the country, but we're looking to do more with partners here in Kansas. We want to work with people who want to connect eaters and farmers in a variety of ways, and I've got 5 of those to suggest for you today. There's produce prescription plans. Those of you in healthcare are familiar with the idea of Produce RX, diet boxes. We can connect those programs to healthy, local, nutrient-dense food. Workplace benefits. You also probably have employees at your company. It's not uncommon. Some of you might have healthcare benefits or workplace diet benefits, and we can be a connector to local foods for those programs. Farm to institution, Grown By as an entire wholesale marketplace to make it easy for restaurants, farm to school purchasers, or school district purchasers, hospitals, et cetera, to purchase from local farms. Make it easy because it's very easy to buy from not local farms, and it's very hard to buy from local farms. We make it much easier. And then the nutrition incentive programs I mentioned, SNAP Online. SNAP Online exists. SNAP Online exists for local farms, but double up bucks work for SNAP Online just like they work for SNAP in person. And then finally, farmer workshops. We educate farmers about e-commerce literacy and cooperative action, founding cooperatives, acting cooperatively. So my last slide for you, I just want to say thank you for having us. Co-ops are a weird little duckling in between nonprofit and for-profit. We're neither. I mean, we are, but we're not. I don't even know exactly how to tell it for you, but I'm happy to be here. We're proud to be here, and we look forward to partnering with folks like you to connect eaters and farmers in Kansas.
Hello everyone. My name is Isis Ashford, and I am the co-founder and COO of Greens Health. Hospitals are under more pressure than ever. This year alone, they will lose $262 billion in preventable readmissions, all the while also losing 100,000 nurses in the last 2 years. Margins are stretched razor thin, and staff is stretched past capacity, tongue twister. And so these rural hospitals are closing at a record rate. And I know this because my father was one of those complex patients, living in a rural town, looking for someone to hold his hand through the process. Instead, he was bounced back and forth between the ER and the primary care without any coordinated support. And so it was left up to me as the caregiver to make sure that he checked his blood sugar on time, he had enough meds for the month, and he overall got better. And that routine and protocol led us to create a comprehensive program where we enroll patients like my father in an at-home monitoring program where day one, we do an assessment to identify if there's any social resources or barriers that are standing in his way. And we also do a mental health capacity check. In the next 5 to 7 business days, he will also receive a device, and this can be a blood pressure monitor, a blood pressure cuff, a weight scale, or a pulse ox. And every time he uses it, if his blood pressure is super high or super low, within a 2-hour time period, an RN will contact him to de-escalate the situation. She will also provide education not only to him, but the family on the best practices to take their medication, making sure that he also has enough meds for the month, and also making sure that he knows how to take the medication. Last but not least, a lot of our seniors have transportation issues getting back and forth to the pharmacy. We established at-home delivery so they don't have to do that anymore. And we know that this works. So with a sample size of 50 patients on 6 or more medications, we've been able to achieve 90% medication adherence. On average, they spend 90 minutes talking to us, and we've been able to take patients from stage 2 hypertension to stage 1 in just 45 days. Thank you. All of these touch points are fully reimbursable. So let's say for all of you connectors out here that know these rural hospitals, these small or medium-sized providers, and they are on the brink of shutting down, we can help them make an additional $150 per patient per month. So let's do the math. With 250 patients, that's $75,000 in monthly recurring revenue, nearly $1 million in annual recurring revenue. So again, I ask the brilliant community of Kansas, if you know these providers, if they are stressed out, they don't know how they're gonna make next month's payroll, please connect them to us and come find me or my wonderful co-founder in the lovely cowboy hat. Thank you.
All right, howdy. There you go. All right, my name is Julia Garcia, and I'm the head of operations at PearSuite. And let me start with a question. Whenever the people in your community need help with food, housing, transportation, or any other resources, how many of them think to call their health plan? Exactly, pretty much nobody. In fact, for most of them, their first call is almost always to the community health workers at the community-based organizations within your community. This is the intake specialist at your local food pantry or the outreach coordinator at your local church. They're the ones with the intimate knowledge of your community that people go to because they trust. But there's a lot of challenges. First of all, these organizations have been traditionally grant-funded and volunteer-driven, and even though the work is extremely important, they've never had to bill Medicaid or Medicare, submit a claim, or go through credentialing. In fact, for most of them, they're just having to depend on a lot of these grants, which right now are being pulled. So this leaves a gap. Health plans are really interested in connecting the members of their community to important screenings and annual wellness visits to improve the quality of care. And the organizations within the community are already doing incredible work, but they're not being recognized or reimbursed for it. That's why we built the that's why we started PearSuite. PearSuite is an AI-powered care navigation platform with tools to track your members, dashboards to see your impact, plus claims tools that allow these organizations to be able to get paid for the work they've already been doing for years. But we knew that technology alone wasn't enough, which is why we started the PearCares Provider Network, and today we have more than 850 community health workers in communities like yours providing all of the same services that they've been doing, except now they're getting reimbursed for those services. And actually, one of our partners for our software is actually here today, and we've been working with Thrive Allen County. So what does this mean for these organizations? They can keep doing all of the services that they've been doing without having to worry about the paperwork. They can actually get paid for the services that they're providing through Medicaid, Medicare, and commercial plans. And they can grow the impact in their community, all while staying rooted in your community. And the results have driven incredible adoption. In fact, we have 62% member engagement, much higher than the industry average. So the people that the community organizations are connecting to resources are actually getting to those resources. We have 3 times increased efficiency for community health workers that are using our software, and almost all of our partners stay. we've had 98% retention of partner organizations. If you are a community-based organization or you know a community-based organization, we would love to be able to partner with you to grow your impact in your community and improve health outcomes. Thank you.
Okay, let's give another round of applause for Caring Health, grown by Greens Health and PearSuite. Okay, so next up, we are going to have the community growth people coming up. So our finalists this round will be Wealthy, We the Village, and Helium. We'll start off with Dr. Moyo with Wealthy.
I promise I won't freestyle. That was a nice beat, though. Hello, everybody. I'm Dr. Stephen Moyo. I'm CEO and founder of Wealthy. And I want to start by saying, don't let this youthful face fool you. I've been caring for patients for over 20 years in hospitals. But I want to share with you, I've never seen it as bad as it is today. Meet Maria, a 16-year-old girl who came into my emergency department after taking 60 pills in an attempt to end her life. Maria was sad because after a recent move, she felt alone and disconnected. And she was angry, not because she tried to take her life, but because she didn't take enough pills to succeed. Maria is one of over 500,000 youth who've been showing up to pediatric emergency departments in a mental health crisis. And frankly, the demand is outpacing our supply. We are short over 300,000 community-based mental health workers here in the US. Further compounding, it takes over 12 years to train a psychologist. I should know, my wife is one. What if I told you, in 1 to 2 years, we can train community health workers and peer support specialists? It costs less, it's faster, and they've been proven to deliver high-quality care. This is why we're launching Health Force Academy. It's a high school to healthcare pipeline, and this is how it works. We start in high schools and recruit high school students. They take a peer educator certificate. They learn how to create impactful health education content, and they can deliver that content into elementary and middle schools. This increases health literacy for young kids and families and whole communities. They can then go on to take a peer counselor certificate. They can learn how to build community, deliver coaching, and supervise counseling in their high school. We work with your school health professionals, and our clinicians are available online in case a case needs to be escalated. Last but not least is career technical education. They learn core skills like compassion and empathy, the soft skills that every physician or clinician needs at the bedside, but also those clinical skills like behavioral health coaching or motivational interviewing. Ultimately, what we want to do is put more community health workers into your communities. Get them certified, get them hired and working in your community, because we believe that community health workers are the backbone of the future healthcare workforce. Together, we're here to partner with you. We want to build a homegrown engine for economic growth, upward mobility, and better health outcomes. And it starts here in Kansas. I've shared with you Health Force Academy, thinking about high school to healthcare, but our real goal is kindergarten to career pipelines, and here's why. Today, if you ask a child, what can you be in healthcare, they're going to tell you two things, doctor or nurse. And all of us here today need to change that, because we need much more healthcare workers. So, if you're a K-12 school district, we want to talk to you, because we're also building Health Force Kids and Health Force Cadets for elementary and middle schools to inspire youth to pursue careers in healthcare. You heard about Health Force Academy, but if you're in higher education, whether you're college, university, or even a medical school, the graduates from Health Force Academy are your future student pipeline. So come talk to me today about that as well. And if you're a philanthropic foundation or an economic development council, this is building a stronger community, a more vibrant community. So we want to enjoy that conversation with you here today. I'm Dr. Stephen Moyo, CEO and founder of Wealthy, and happy to be here. Thank you.
I'm Jane Mackey, CEO and founder of We the Village, and today I'm going to share with you the best and untapped resource for addiction recovery. But first, let me give you some context. 1 in 5 Kansans meet criteria for addiction. And 95% of those people don't believe they need to change their behavior or need support to do so. So while a lot of focus goes on prevention or treatment, most people aren't actually accessing it. And that's where families come in. Families are on the front lines of addiction. They are the most influential and underutilized resource in recovery. And it's almost half of Americans that are affected. We've developed a program to harness the power of family influence. We've used our lived experience combined with our experience growing and building online companies and joined forces with the creator of the leading evidence-based therapy specifically for families who have a loved one struggling with addiction. And we've developed the We the Village Family Program. It's an affordable, evidence-based online course with optional expert coaching over Zoom. And to maximize scale and reach, we also train professionals to deliver this therapy and coaching sessions. We have the clinical proof to back it up. We've spent the last 5 years running our program through a clinical pilot and full-scale randomized clinical trial funded by the National Institute of Drug Abuse. And we've proven that by working with just one concerned family member, we can change the whole trajectory of an addiction in a family. The results for our clients, 90% of them report improved communication with their loved one, 86% have increased confidence navigating the addiction recovery journey, and 70% feel less depressed and less angry. And when it comes to their loved one, 7 in 10 of them have a loved one become willing to enter treatment in just 3 months. They also see a significant reduction in harmful substance use, and 4 in 5 loved ones remain engaged in treatment supporting recovery beyond 6 months. We've been trusted by over 1,000 families to date, and we've trained over 400 professionals. We are a NIDA, National Institute of Drug Abuse, company to watch, and we're listed in their current strategic plan. We've been funded statewide in Colorado since 2020. We're in the best practice standards for the National Association on Drug Court Professionals, and our treatment provider referral partners are growing. We can partner in many different ways, but a couple of them here. Send us families. We can support them, we can upskill them, and if you're a treatment provider, we can send them back to you when their loved one becomes willing to enter treatment. We can co-brand our program like we do in the state of Colorado, and then you can deliver it to your communities, and we can integrate, so we can train your staff to deliver the coaching sessions alongside our program. The way we recover matters. With our programs, families don't just survive addiction, they recover better together. So for all of you in this room, whether you're the one person that knows someone struggling or knows someone that knows someone or has someone in their life that's struggling today with addiction, we would love to be a resource for them. Please share us. Our individual program starts at just $65 a month. And we also offer professional training, and you can access that on our site as well. Thank you.
Hi everyone, my name is Kari Ricks and I'm with Helium. This is mental wellness for a new reality powered by your body's electricity. And it's for anybody that struggles with stress, anxiety, burnout, or PTSD. There is a mental health emergency. People can't self-regulate their hearts or brains. But why is it so hard? Because the brain is a muscle that they can't see. And so this is Ebony. She's a pain clinic patient, and she wanted something to help her reduce her stress. She picked up the VR Helium goggles and got fully immersed in beautiful Helium experiences. She also connected her Apple Watch to read her real-time heart rate. She now can see her feelings in real time. As she calms down, she can gain more control of her particles in the palm of her hand, teaching her how to self-regulate her emotions. Helium, in the virtual reality platform, there are over 50 experiences, from nature-based to computer-generated, and they focus on positivity, sleep, and mindfulness. And when you connect the wearable like the EEG headband that reads brainwave activity, or the Apple Watch that reads heart rate, you now can see your scores over time with the Helium score. So just like you track your steps, your calories, you can track your mental wellness. And as for users and clinicians, they can see progresses and successes over time. Clinicians now can submit this information for reimbursement and create another revenue-generating tool for the business as well. So now you can finally see if the solution is working. You have this data and see how your organization is doing over time. Helium is clinically validated in 9 peer-reviewed journals, including the Mayo Clinic. This is the study done on the brain of a firefighter, and the left side is before using helium, and the right side is only 4 minutes after using helium. You can see a significant decrease in the fast brainwave activity. So who is the helium for? Well, like I said, it's for anybody that experiences stress. But we've seen a lot of success when we work with mental wellness clinics, the VA hospitals, the schools and the universities, with the clinicians and the providers that help their patients that are struggling with stress and anxiety. So as for Ebony, this is the Stress Olympics, but fortunately for her, she has trained for it with helium. She now knows how to control her feelings inside of the VR goggles, but also in the real world. So this is Helium, mental wellness for a new reality, powered by your body's electricity. Thank you.
Okay, 7 down. What are you guys thinking so far? Yes. I see so many pins, let's say the Blue Cross Blue Shield pins moving throughout the room today. So make sure you're writing down any connections that you think of as they pitch. If anybody has driven down Kellogg or Webb Road this week, there is a nice billboard, courtesy of Visit Wichita, that says, pitching big ideas. These are big ideas. You guys, you are doing such a great job. This last half, I'm going to introduce our vibrancy piece. We have Kind Ed coming to the stage, Poco, and Quayla.
Should I just start going? All right. This is for your sake, not mine. And where I come from in Chicago, we have 8 pitches. So I really appreciate that Kansas will respect the 8-minute pitch. No? Okay. All right. Hi, everyone. Thank you so much. My name is, you know what, I should fix this. Holy crap. All right. My name is Jane, and it's being recorded. Damn. My name is Jane. I am a former public school teacher and the founder of Kind Ed. We provide social media and AI literacy to support critical thinking online and healthy device habits. I started teaching in 2014, and we had a restrictive phone policy, but it's not enough. 10 years later, kids are spending, on average, 50 to 60 hours a week on screens outside of schools. This impacts all other areas of their life, from school to sleep. And it's not just the kids. The average American checks their phones 200 times per day. I am seeing some very strong arms in here. Now imagine doing 200 push-ups a day. You wouldn't need us. No, I'm kidding. But screen use and the features of social media apps and games, they are driving issues in our society and absolutely in our schools. Educators report reduced attention spans, issues with self-regulation, and declining social skills. It's amplifying conflicts, even threats to school, spreading faster than ever to wide audiences. Behaviors online are absolutely harming relationships, not just among students, but with their families and their learning. These problems are extremely costly. Spending for mental health supports, from hiring social workers, counselors, to phone pouches and monitoring apps on school-issued devices. How did we get here? Agency is the belief that you are in control of your thoughts and behaviors. Today's engagement technology is designed to create low agency in users, and we are hooked into long periods of mindless screen use and impulsive habits. Children's brains are being rewired into harmful digital habits. That's all I got. No, I'm kidding. The good news, is that we can change our habits, dun, 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 and we can grow our agency. With high agency, students feel more in control. They can reduce impulsive behavior that can safeguard and improve mental health. KindEd is a behavior-focused program that uses inquiry to build high agency. We take students on a journey starting with self-awareness, how they use devices with their friends, with their family, in schools, to start creating shared values and norms. Students explore how the use is impacting their mental health and how to protect it. More than by choice, it is by algorithm design and driven that we have these harmful features that impact us, such as like instant gratification, social comparison. Our curriculum has students routinely engage in decision making and critical thinking online so that they can keep themselves safe and form healthy boundaries. Because digital footprints, they last forever. You know who you are. I know, she was really cute. Shouldn't have sent that photo. No, I'm kidding. Lastly, and most importantly, they are learning how their individual behaviors are contributing to big problems and big solutions that enter classrooms and communities, from sharing achievements to echo chambers and polarization. Our fun and relevant curriculum is going to strengthen relationships, and it's also going to empower students. Currently, we have grades 6 through 10, but we're building K-12 and a solution to go direct to families because, let's be honest, we all need it. So we're gonna provide an ecosystem of support. From a single lesson, we can create awareness around device use. But with our ideal implementation, we can really change behavior because habits form over time. And we're already making an impact. Students in our pilots self-report decreased screen use, better understanding of how algorithms are influencing their feed, and they feel closer from just a single lesson. It's not magic. It's what happens when you build real human connection. We would love to partner with schools, school districts, anyone who has kids, works with kids, was a kid, because we want to support every Kansan kid and family. Because digital well-being and critical thinking online today is important for individuals and communities, and it is a social determinant of health that can improve relationships and life outcomes. Thank you so much.
Good afternoon. I am Sonia Witzink, and I am the Executive Vice President of Data and Insights at Polko. It's a big, long mouthful, and a very important role that I'm playing. At Polko, we're a veteran-run technology company, and we help make communities healthier and stronger. We do this, we've worked with communities over the last couple decades with our thought leaders, and we help them bring data into decision-making. We all know that public agencies should engage their constituents and they should bring data into their decisions. But if you have the expertise to do this, do you have the time? Polka can work as a fractional research department for your organization to help make sure you have that data while improving engagement. As a past showcase winner, I'm really excited to share the evolving ecosystem at Polko. You already may know that we can help you find key metrics. We can gather input. We put that all together into visualizations on your dashboards, and then you can query that with AI. So those who are not as savvy with data, they can find that and have a little bit of help figuring out how to read all our tables and all of our charts. And if you don't already partner with us, we hope that you will soon. Last year at this showcase, we introduced Grace. We were developing an AI-assisted grant writer, and it was using the data that you have on Polko for your community with a gate around that data to make sure that you have more effective grants that were based on needs assessments, and you could show that need through data. We actually worked with Thrive Allen a lot. They were very helpful with us on testing out Grace, and we're excited to say that Grace won her first $100,000 grant for the city of St. Petersburg. In working with Thrive Allen and other communities and in developing Grace, what we realized what was most powerful about AI agents is when they did have your data and your context, and you had that safety fence around your data and your context because you don't want to share all of the stuff. And from this, we started building fully custom agents specified to your purpose. So think about something that you have to do every week or every month or even every day. Maybe it's just writing a report or something more complex. But it's a task that you know that technology could take care of. What could an AI agent learn about your organization? Your data, your codes, your policies, your procedures, your strategic plans, and what could it do with that information? So think about, like, could it generate that weekly report? Could it answer resident questions? Could it assess applications as they come in and be a first review on documents to make sure they fit with your strategic plan? Could it facilitate input? You bring us the challenge, and we help build the AI agent that will help you solve it, letting you focus on all of the really important and complex and nuanced things that you do for your community that only a human can do. So at Polko, just to summarize, our goal is to help the public agencies leverage AI software and other technology while bringing resident input into play. We found, so we want to engage all your residents and bring in a data-informed renaissance with the ultimate goal of improving the quality of life in your communities. I've put up a QR code here for a webinar we're having next week if you want to continue this discussion around what local governments and public agencies can do with AI. Thank you.
All right, let's bring this home. Best for last, they say, right? My name's Ali Jabri. I'm the CEO of Quema. $56 billion with a B. That's how much workplace violence costs our economy every year. I'm sure most of you didn't know that stat. Another stat you guys probably don't know is that healthcare is the most dangerous industry to work in. Every hour, 2 nurses are assaulted. A stat you guys probably do know is that we have a huge shortage of nurses in our workforce today. Workplace violence is one of the main reasons. Now, we have to understand, where does workplace violence happen? It happens in the brick and mortars, the clinics, the hospitals, and because these are targeted acts of violence, it happens in parking lots. The term is patient-generated violence. And because the future of healthcare is at the patient's home, it also happens at the patient's home, especially in our community health, for our community health workers. So we took something healthcare workers wear in every scenario and made it smart. We created the world's first smart badge reel. Super simple. You attach your ID card to it, right? You badge in, badge out. But what we did is we put a little button on the side of it. So if I feel unsafe, I could discreetly press that. It vibrates so it knows, so I know it's been triggered, and then it sends your exact location to security that can get to you in a minute or less. Or if you're a home healthcare worker, it piggybacks off your cell phone and sends your GPS coordinates to the police. In both those scenarios, we're reducing response time, which is measurable and has been proven to drastically lessen the severity of a violent incident. Let's take one of our biggest customers, Integris Health, biggest health system in Oklahoma. Before deploying Quema, less than 38% of their staff felt like they could do something whenever something went wrong. In just 3 months, the number hit almost 90%. And that was enough for Integris to roll us out to all their home healthcare workers and their behavioral health facilities and their EDs. And Integris is pretty proactive, just like some of these customers, Kaiser, Emory, Endeavor. But the truth is, being proactive is not enough anymore because there's mandates coming. These are states that have passed panic button laws for employees. You know why? Because it's proven to be effective. Our business model is so simple. We charge as low as $5 per month per employee and as high as $25 per month per employee. What's the variable? User count. We're incentivizing organizations to put everybody on the platform. Don't pick and choose because safety is key and you don't know when a workplace violence incident is going to take place. So let's talk about ROI. We've proven to increase retention, which is a really big North Star, something that a term that we like to use a lot is psychological safety. Increasing psychological safety highly increases the quality of delivery within your healthcare workers and obviously addresses retention as well. Last but not least, the obvious metric is the reduction of a workplace violence incident. And that means more lives saved and more care given. Now, hospitals have seen these results in 3 to 6 months. And I've talked about nurses a lot, but let's talk about who else wears our reels. Home healthcare workers, hospice workers, social workers, pharmacists, medical drivers, behavioral health practitioners, physicians, and even executives. The goal is simple, ladies and gentlemen. When you're real safe, you feel safe. Thank you very much.
All right, we got, I'm not that tall. Boy, I'm not that short either. Okay. What'd you do, guys? How about I just hold it? How about we do it that way? All right, we've got one more video we're going to show you. Danny, you got me? Okay, go for it, man.
Hello, my name is Kobe Takeda, co-founder and CEO of PearSuite. PearSuite is an AI-enabled platform and provider network that empowers community health workers to deliver coordinated care, measure impact, and unlock sustainable revenue. We joined Nexus because we saw Kansas as a place full of innovative health partners and forward-thinking communities. The program offered a rare opportunity to connect directly with these organizations and co-design solutions for them. And for that was huge. We just don't believe in one-size-fits-all solutions, and having the ability to work with local partners has been great.
It's so crucial to have partners from around the state that know their community and they know their community's ambitions. So the challenges that are faced and the things they want to overcome in order to grow and thrive and keep their people healthier. These partners come to us and they tell us their needs, and then they roll up their sleeves, evaluate these innovators, and figure out what's going to work best in their community. Who's got most relevant solutions, who's got the most promising technology tools, and then they dive in to try innovation projects to see if they can make a difference in their communities.
Coffee County is a small rural county of about 8,500 people. We're very fortunate. We have our own hospital in Coffee County. We have a fantastic health department, but because we're rural, we've had clinics close recently. Health-wise, you know, I'm always looking for ways to bring new things to help our community.
Community leaders from around the state get brave with us. They tell us they're community leads, but they also look at these innovators, these startups, and the solutions they provide, and then they think differently about what could work in their community. They are either implementers of pilots themselves, healthcare facilities, community organizations, or they're the connector to folks in their organization and in their community that could be the implementers of these technologies. We love that they lean into innovation to try to move their communities forward.
I learned a lot about Kansas and the communities we serve. They're deeply connected and collaborative. They're really committed to helping across sectors, whether it's housing, transportation, food and security, and they saw that spirit of partnership come together with partners like health plans and health systems as well. Certainly, I'd recommend this program for others. It's been amazing for us. Since we've launched in Kansas, we have now 6 different customers across the state and are partnering with local health plans to do more and support more organizations, really to expand the impact of this work and to make it more scalable.
A lot of times when people think about new and innovative or technology, your first thought is not rural Kansas. And I don't think it has to be that way. There's so many people in our state that are working so hard to boost the health in our communities, and I'm just thankful that there's organizations like Nexus that are out there trying to help connect our small communities to better pathways to health.
All right, a brief shout out to the people who've had to endure the pain of watching themselves on camera today. Travis, Jenny, Colby, thank you so much. Okay, here's the speed round. Are you ready? That video illustrated the courage, the drive, the reasons behind our community partners getting involved with NXTSTAGE. A kudos to all of the folks gathered here today, particularly to Colette as our project manager this year, program manager this year. We had a record number of community partners, and you're about to hear what they've decided. So this is going to be, I mentioned speed round. We're in the ballpark. We got to have something cool going on with baseball, right? So this one's actually yours, Blue Cross Blue Shield. I don't know, you guys can rock, paper, scissors for it down there. But what we're doing this year is we're going to have each of the partners stand up when their slide comes up and it's their turn. And then all of the startups that they are either going to do pilots with and are ready to announce that today, or they're continuing to dialogue with and communicate with because they'd like to build towards a partnership. So we have pilots to be announced. We have continuing connections and dialogue that are ongoing. And at the end, I'll tell you sort of what all that adds up to. But I want everyone in the room and everyone watching this online to pay attention. You hear these startups' names in many cases over and over again. You are hearing a recommendation from your peers. You are hearing from folks that face the same community issues, that have the same challenges that you do, and they have been the ones that took this field from 143 competitors down to 10 finalists, and then ultimately to the ones that they're going to choose to do projects with. You can learn, you can ride their coattails to access to these innovators to get a shortcut to providing these solutions for your community members and for your organizations. So here's how we're going to do it. Who's going to be my first guinea pig? Kelly, you're going to be my first guinea pig. Kelly Hansen, we're going to, oh, I'm driving, aren't I? Slide. Danny, am I driving? You're driving. Okay, I'm going to let you drive. Kelly Hansen with the Kansas Department of Commerce, Kansas Office of Rural Prosperity. So Kelly, I'm going to make you stand. Kelly, who is an incredible steward of our tax dollars and who is connected statewide from her home in Plainville, has chosen 6 of our partners. She's not going to be the executor of partnerships, but she has got connections and conversations that have begun and will continue with these partners. So startups, when I call your name, I want you to stand. At the end of each pilot partner's announcements, we'll do a round of applause, and then like our cool signed baseball for Blue Cross Blue Shield, which all of the pilot partners have signed for you guys, each of the startups will get us a baseball signed by the partners that chose them. So there you've got the autographs of the folks that want to work with you. Okay, so Kelly and the Kansas Department of Commerce Office of Rural Prosperity, here are the ones they're going to work with in connections, and I'm going to talk a little bit about how they're going to get them engaged in the community so you all can learn from them. Greens Health, they want to get them to work with rural hospitals around the state. Stand up, ISIS and Keelan. Grown By, they're thinking maybe the Kansas Health Foundation and their initiatives board can get involved. Double up on food bucks. Get Grown By out and about around the state. Pear Sweet, where are you? Got our dual? Okay, the team from Pear Sweet. Polko. We think the Office of Rural Prosperity and rural communities can start to use Polko's data and AI solutions to make their work even more effective in our communities. Wealthy, they're really thinking Northwest Kansas is the place for you to go with the Innovation Center alongside Live Well. And then We the Village, grant opportunity, again, Northwest. We think that may be the way to make that happen. Kansas Center is waiting for you. Ladies and gentlemen, all of the startups getting the shout outs from their baseball signer, Kelly Hansen and the Office of Rural Prosperity. Okay, our next pilot partner is not able to be with us today. He's a first-time partner, ended up with a terrible ear infection. We did not want him German up the room, so he is home in Cloud County. And as a new partner, he's decided today, super focused. He's got one partner that he's beginning discussions and connections with, not ready to announce a pilot today, but ready to advocate for this organization in Cloud County. Wealthy, Dr. Steve, stand up, man. Okay, Jenny Tapman with Coffee County. All right, she's not wearing the same shirt as she did in the video. She's super smart that way. She has 3 organizations that she's ready to announce today. They are going to move forward with a pilot, plus a couple more that they've got continued discussions and connections. Their pilot winners, Cairn Health, Grown By, Polko, stand up, ISIS, Keelan, Polko team. You guys got to play by the rules here. Okay, and then additional connections, Kind Ed. We want to get you in their schools. Wealthy, Dr. Steve, stand up again. Ladies and gentlemen, Coffee County. All right, where's Isaiah from Hodgman County? There he is. Okay, new partner. He took the helm of this program from his predecessors, Sailor Ann Seiler and Leanne Seiler. So small women, big shoes to fill that Isaiah has done an incredible job with. He is going to town. There are 5 partnerships he's ready to announce today, plus 2 more startups that he's going to work with. His pilot winners include Cairn Health, Greens Health, Kind Ed, Helium, We the Village, and then he's also going to work to connect in his community Quema and Pear Sweet. Hodgman County leaning in, ladies and gentlemen. Live Well Northwest Kansas, Travis Rickford, a veteran partner. He is going to announce 3 pilots today, plus another company he's still trying to figure out how to navigate. Ladies and gentlemen, pilot winners for Live Well Northwest Kansas, Cairn Health, Pear Sweet, We the Village, and Grown By. You guys stand up too. He's going to try to make this happen somewhere in his community. So Grown By. Where'd he go? Yeah, Eric's over here. Sorry. I keep looking at the greens and the grown bys and messing it up. Thank you very much. Live Well Northwest Kansas. Let's see what we can do for folks in that region. Okay, a new partner this year, Patty Meyer, and I want to go, make sure, Hannah Boudreau, her wing person in this whole competition, gets to stand up alongside her. Brand new partners this year. They've got 2 pilots to announce, and then a handful of folks that they're still trying to connect up in Newton to make sure that they get implemented in their community. Ladies and gentlemen, pilot winners for Newton Medical Center, Cairn Health, We the Village. And then, all right, now I'm looking at you, Isis and Keelan. Greens Health, Helium, Kind Ed, Quema, and Welfie. All of those folks, you've got life to be lived in Newton, connecting for those solutions. Thank you, NMC Health, for your involvement this year and your leaning into these innovations. Okay, our next partner, where's Jenny? Jenny's over. Jenny Russell with Republic. There she is. She is sunsetting as the Republic County Economic Development, but she has played an important role in our competition the last couple of years, and she has got 5 of the startups that she is connecting to her successor and to the folks up in Republic County. So please stand up when I call your name. Greens Health, Kind Ed, Quema, We the Village, and Welfie. All right, we got 2 more to go. Woo-hoo. All right, our next pilot partner on her 3rd year, Janae Talbot. Where are you, Janae? Are you over here? There. Oh, she's in the back of the room because she's already standing. I love it. She's leaning in. That's Janae, if you know Janae. She has 3 pilot partners. She's already worked with them on grants. She's got funding coming in. She is raring to go. Ladies and gentlemen, her winners include Helium, Quema, and Polko. Okay. Last but not least, we're going to have the ladies from Thrive Allen County, who also run Thrive Kansas. So Jess and Lissa, they have 6 pilot winners to announce, and 3 others that they're still going to continue to work with. Those big muscles that Jane showed you these guys have big muscles for innovation in their community and around the state. So we're excited for the partners that get to work with them. Are you ready? Cairn Health, Grown By, Kind Ed, Pear Sweet, Polko, We the Village are all pilot winners, and then 3 more companies they're going to continue to facilitate for: Greens Health, Helium, and Welfie. Thrive Allen, ladies and gentlemen. Okay, so what is this all resulting in? And then we're going to let you guys out of here in just a second. So first of all, remember, your role here today is connector not only to people in the room, but to people not in the room, and frankly, to a new way of thinking. You are going to, Nextus is called Nextus for a reason. We see ourselves as on the team to create the next us for our region. And in this realm, it means thinking differently. It means trying new things. It means innovating, working smarter, not harder, in order to serve our people better and create outcomes for community health and community vibrancy. Don't forget your role in that as you leave this room. But what did this all result in? So remember, we had, there we go, 22 innovation projects announced today, plus 24 continued connections We will stay in touch with these partners, see what happens to those 24. But ladies and gentlemen, that is in fact the highest number of announced projects we've ever had for this competition. Our 9 community partners are to be congratulated. Our 10 startups are to be admired. Be inspired by them to do great things in your community and use them and the tools they provide to help create the outcomes that are going to be the best outcomes for your people. And that, as Nexus's mission, helps us become the proving grounds for tomorrow's breakthrough technologies in this field and beyond. Thank you so much for your time today. Stay in the room and connect if you like. And we will look for you next year and we'll have some more great results to report. Thank you very much.